Obesity is a complex condition that goes beyond the simple measurement of weight.
Yeah, for decades, body mass index, or you might know it as BMI, has been the standard tool to assess obesity, though some new findings suggest it really has some significant limitations.
And joining us is Dr. Pavlos Papasavas, who is the Director of Research in the Surgery Department at Hartford Hospital, to discuss how Hartford Healthcare is tackling this discovery. Doctor, thank you for joining us.
Thank you for having me.
Yeah, can you explain what is clinical obesity?
Yes, a recent publication by an international team of scientists proposed to classify obesity into two categories: clinical obesity and preclinical obesity. Clinical obesity is a chronic disease of excess fat that causes dysfunction of organs in the human body. So organs like the liver, the lungs, the heart are not functioning normally. And this has a risk of developing severe complications such as a heart attack or stroke. Preclinical obesity is a stage before, where a person has excess fat in their body, but they have not developed organ dysfunction.
So, doctor, how do these findings of BMI impact the way you treat your patients?
BMI does not measure fat in the body. It's a mathematical formula. It's a proxy to how much fat we have in our body. And it does a good job for the high BMIs of 40 and above. But for the lower BMIs, it can be inaccurate. For example, you have a person with a BMI of 25 and they have a normal number, but they may have more fat in their body than normal, and they may have diseases that are associated with the excess fat. On the other hand, you can have a BMI of 28 on a very muscular person, which is abnormal, but they are very healthy. So BMI does not tell us where the fat is in the body. Is in the abdominal area, which is worse, or if it's in the lower body, which is healthier. So it has many shortcomings.
So tell us about the surgical and the medical weight loss options that you offer at Hartford Healthcare, and who really should consider them.
Physicians now have more effective options to treat obesity more than ever before. The second-generation medications are twice as effective as the first-generation medications. Metabolic and bariatric surgical procedures, such as the sleeve gastrectomy, the gastric bypass, are the most effective in offering long-term weight loss, and they have an excellent safe profile. Our team approaches obesity in a very comprehensive way. We do an evaluation and a lot of teaching about how people can embrace a healthy, balanced diet, more physical activity, and we offer the latest medications and surgical procedures.
Well, Dr. Papasavas, Hartford Hospital Surgery Department Director of Research, thank you so much for all of this great information.
Thank you.
Thank you, doctor. And for more information, you can go to hartfordhealthcare.org. Just click on services, and you can look for medical surgical weight loss.